I would like to welcome our guests in this morning. Good morning, guys. Dr. Lawrence Cooperstein and John Urie. Thank you for joining us this morning. Glad you could be here.
Thank you.
Before we get into the reason why you're here, let's learn a little bit about yourselves. We'll start with the doc.
Well, I've been at Titusville for about 9 years now. I started my career down in Pittsburgh, worked at several different Pittsburgh hospitals for a number of years, and have been here, as I say, for about the last 9 years. I'm in charge of the Department of Diagnostic Imaging, or the Department of Radiology, so I oversee all the imaging functions in the hospital.
Wow, very important.
Well, not particularly that important, but thank you for the compliment.
I know in situations that family has been in, having those images and just making sure everything in that department runs well is very important. So,
well, that is true. A lot of how the department runs is really run by the technical staff, which is excellent. We have some very good people working in the department. I do oversee it all, but most of it tends to run by itself, and it's a pretty well-oiled machine.
Well, good. And that's a good thing to have in a hospital because time is important and every second counts. So to have a department that is that efficient is extremely important.
I agree. We take it seriously.
All right. John, tell us a little bit about yourself.
I'm John Urie. I've been the chief MRI technologist at Titusville Area Hospital for the past 11 years, going on 12 years. I've been doing MRI for approximately 14 years.
Wow.
So, yeah.
And how'd you get started in that?
I was a X-ray technician to begin with, and then I was fortunate enough to learn MRI on the job. I worked for the mobile company that came to Titusville before Titusville had their own MRI at the hospital, so I had a relationship with the people at Titusville. So when they got their own MRI at the hospital, they asked me to come and work there, and I've been there ever since.
Does it amaze you that a small hospital or a small community like Titusville can have the kind of hospital that we have and the technology that's available? I mean, that to me, every time we get information on something new at the hospital, it's like, wow, I can't believe Titusville has that kind of technology here.
Yes, it really, truly is amazing. I mean, we were very lucky for a small community to have the equipment we have in the radiology department, not just this new MRI scanner that we're going to be talking about today, but all of our equipment is state-of-the-art. It's as good as you're going to find in Pittsburgh and Erie. Our technologists could go anywhere in the country and work. We're fortunate to have great radiologists like Dr. Cooperstein that work here in Titusville. I mean, we are very lucky.
Well, I appreciate the kind words, but I would just say that one of the reasons I actually came to Titusville was because there was that commitment to having a first-class radiology department.
Wow.
It was clear that the equipment was good and that there was a commitment to keep it state-of-the-art. And I would say in virtually every area of the department we have state-of-the-art equipment. There is nothing better out there.
That's incredible. What's it say for the community? When there's a golf outing for the hospital or events, to raise money for equipment like that. I mean, when the community comes out and shows that support, that says a lot, doesn't it?
It does, and that's important. As long as you mention the money side of things, these are expensive pieces of equipment. The hospital's and the community has made a huge commitment to spend this kind of money to have equipment this good in the hospital.
Tell us a little bit about the new MRI machine, because this is quite amazing. And I guess as you explain the new machine, what does it do that makes it so much better than the older versions?
Well, this machine is a wide bore magnet is what they call it. And I believe we have a picture of the Ingenia front picture that we could look at here. But the bore is the opening in the machine. It is now 70 centimeter, where our old scanner was 60 centimeters, so it's much less confining. This is an image of a bariatric patient, pretty good sized guy there, and we'll see on the next picture how he fits in there with no problems. So it's much less confining there. You can see he still has room there. So that's one thing, the wide bore magnet. The biggest thing is the new technology. The Ingenia from Philips Healthcare is the first ever digital broadband MR system. We're the only hospital in Western Pennsylvania with this new technology. And what the digital broadband does, it increases, basically when you're taking an MRI image, most important thing for the quality of the image is the amount of signal that you're getting from the patient. This increases the signal by 40% by digitizing the signal directly at the coil. We call them coils. We try to get them as close to the body part that we're imaging as we can. That picks up the signal from the patient. That signal's generated into an image. We're increasing that signal by 40% with this new technology. So with that extra signal, you can make the exams faster, or you can make the exams higher resolution, nicer images, more detailed to look at for the radiologist. So it gives us some options.
So when you say faster, I'm picturing somebody in the older MRI machine kind of squirming. It's a little uncomfortable for them. You're trying to tell them stay still so we can get a good image. So you're saying by faster, you can get somebody in, snap it, and out, and they don't have to be sitting there squirming as much.
Exactly. MRI is always a balancing act. You want to get the best pictures possible for the patient and the radiologist to look at, to diagnose from. But at the same time, you want to get the exam done for the patient. So you have to balance that with every patient's different, every situation's different. So some you need to do faster to be able to get them done. Some you can take a little longer and get even better images.
There's the digital broadband component to this. How does that help you, Doc, when you get those images then? I mean, are you able to get those immediately?
Well, it doesn't so much improve the speed with which I can get the images, because I can get those immediately now.
Okay.
But what it does do is it makes the images sharper. We see more detail. We can see millimeter-sized things within the body. We have much better image resolution, and by resolution I mean two things. One, spatial resolution, how small can I see something, and also contrast resolution. How different do two structures have to be for me to be able to tell that they're different? And this technology increases both. And as John mentioned, it lets us do these exams quicker. And for patients who don't like being in the machine, who get a little squirmy in there, we can speed things up. And MRI, since I've been doing it, has been steadily improving, steadily getting faster. We do things now probably in half to a third the time it used to take before.
Wow. That's very impressive.
It's quick. It's quick, and patients are more comfortable because of it.
So when you're looking at an image from the older machine, an image from new, you're able to see things on the newer one that maybe would take you a little longer to discover on the older one?
Or you may not be able to see it all on the older one. We have plenty of examples already. We've been up and running now for several weeks, and we have had some patients come and have scans done that have had scans done in the past, and we have those to compare with. And just comparing the two, the differences are obvious.
Wow.
There's more detail on the current images. I can see things that you just can't see on the previous ones.
It sounds like a bigger, better machine means more that you can do. Is there anything new that you can do now that you weren't able to do before with the newer machine?
Yeah, we're actually able to offer breast MRI for the first time now with this new scanner, so that's exciting. And also, not only do we do the breast MRI, which we're getting a very detailed, high-resolution image of the breast, when we're finished with those images, we send them to a DynaCAD workstation, which is another workstation for Dr. Cooperstein. The CAD part means computer-aided detection. And that's like another set of eyes for Dr. Cooperstein, to help mark things and see things that, just an aid for the radiologist to look at. So we have that technology along with the high resolution images that we're already obtaining from the MRI. And if there would be a suspicious area that we need to biopsy, we can also do that now at the hospital.
Wow. And with October coming up, Breast Cancer Awareness Month, this would be the ideal machine to help somebody who might be at the age that should be in there getting a checkup. And I know we'll get back to some MRI stuff, but with breast cancer awareness coming up, what is that age that women should start to, I guess, be seeing the doctor and saying, okay, what do I need to do?
Well, guidelines are a little bit in flux, and there is a little bit of controversy in terms of screening guidelines. And for this, I'm talking about mammography specifically. But I believe that a woman should have a baseline screening mammogram sometime between the age of 35 and 40. And then depending on risk factors, either begin getting regular mammograms at yearly or 2-year intervals, depending a little bit on the situation. Some people recommend a baseline somewhere between 35 and 40, and then maybe not another mammogram for another 6-8 years. But it all depends on the situation. But even with this technology, with MRI, mammography still remains the mainstay. That's the one exam we recommend for every woman. MRI we reserve for particular types of cases, and not every woman needs an MRI or should have an MRI.
And that kind of leads to a couple questions. What is an MRI, and why does somebody need to have one?
Well, MRI stands for magnetic resonance imaging. MRI uses a strong magnetic field, radio frequency pulses, and computer technology combines those to make a very detailed image of the body. It's another imaging technique that we have at the hospital. The second question, I'll read.
I'm sorry, you're at the second half of your...
Why would somebody need to have an MRI done?
Well, MRI is just it's another way we have of imaging. We have a lot of different ways we can image body parts, from regular X-rays, which we've had for a long time, things like sonography, ultrasound, CAT scanning, we've had for a long time, particular nuclear medicine type procedures, which use radioactive substances. But MRI is the newest. MRI provides us greater soft tissue resolution than we've ever been able to have before. We can get greater detail in anatomic areas than we've had before. And it's really revolutionized imaging of the brain, of the spine, of the musculoskeletal system, of the vascular system. There's just so much we can do with MRI, and now being able to add breast imaging to that is really a nice complement to what we've been able to do before.
So this new machine then can offer maybe some new services up at the hospital?
We do have some new services. The breast imaging, breast biopsy are new, but we've also vastly improved our vascular imaging, what we call MRA, or magnetic resonance angiography. We're able to image blood vessels in all body parts, in the brain, in the abdomen, in the chest, in a way that we've not been able to do before, and to get much clearer detail, much better images.
John, when a machine like this comes into the hospital, do you have to spend time training on a machine like this, or is it something that's still familiar to you?
The basic concept is the same, always going to be the same with MRI, but every system is different. So yeah, we had a Philips scanner before. This one's a lot different than the old one. So yeah, there's a lot of training involved. We had, I went to Cleveland for a week. That's where Philips USA headquarters are at. Before we got the scanner, the first 2.5 weeks that we were in operation with the scanner, a representative from Philips Applications was there with us, helping us. And I've been back to Cleveland since then for a second week of advanced training on this new system. So yeah, they are very different.
It looks like a pretty big piece of equipment. It comes in parts and they put it together in the hospital?
Well, it comes in one. The main piece, what you see there, with the beige color and white color. Those are just shrouds that cover the magnet. The magnet's inside that, but the magnet's pretty much close to that size, and it comes all in one piece. So this project, it was a big project, taking the old one out. Well, you had to take a wall out in the hallway, completely out, get the old one out, and bring the new one in. So, yeah.
Is that, I take it there's some planning involved in that, because obviously you have patients that you need to keep monitoring and get in there to have these tests done. What's the downtime on something like that?
This project took about 8 weeks.
Wow.
Yeah. So,
And during those 8 weeks, we did not have a machine based in the hospital. We had a mobile unit that the hospital brought in so we could do patients during the time we were down. But it is a huge operation to get an old machine out and a new machine in. These things weigh a lot, and they are big, and it does require a lot of planning. And as John said, a wall came out to get this thing in, and then to put the wall back up. It's not easy.
You know, I was wondering, listening to all of this, is, and this goes back to the people who will probably have need to use the MRI, but is an MRI something that everybody would need? Or are there certain people who could tolerate an MRI better than others, I guess is what I'm saying?
Well, not everyone needs an MRI. It depends on clinical problems. MRI certainly has a lot of applications in certain areas, fewer applications in others, and we try to pick and choose what patients would benefit the most from it. In terms of breast MRI specifically, which is something new, not every woman needs this. As I said, we tend to start with mammography. If we have any questions, we usually move to ultrasound, sonography to settle some of those issues. But now we have a third imaging modality, MRI, that we can also use now for problem cases. And there are particular women who are at much higher risk for breast cancer, women that have already had breast cancer, women who have a strong family history of breast cancer, women with particular genetic abnormalities that very much predispose them to cancer. And those are people that will also benefit from MRI, which research has shown to be very sensitive in detecting small abnormalities in these particular women.
I know recently in my own experience, after an accident, I was in an MRI unit, and I kept thinking, you know, the wrist is broken. You know, it broke the skin. What else do you need to know? What can you gain by further imaging?
Oh, well, I don't know about your particular case there, but MRI gives tremendous anatomic detail, and in terms of making decisions regarding surgery, number one, do you need surgery? Number two, what surgery would be best for you? Nothing is as good as MRI, and that's true in musculoskeletal imaging. It's true in the spine. It's true in the brain. It's just becoming more true in more anatomic areas.
Well, that certainly cleared that up. I'll stop yammering about all the extra work.
Well, I would think that, especially with the newer machine and having those crisper images, you know, in your case, you were in an accident. You don't know what else might have happened inside your body. Here's a good way of looking inside and finding out.
Right. It's an excellent way of finding out, and we have the ability to image in all different planes. We can look at things, if you will, from any angle we wish to, and then mentally create a three-dimensional picture of exactly what's going on. So it gives us a lot of capability that we haven't had before.
This being a newer machine, when did you guys first learn about this? And was it one of those things that you kind of put on a wish list, or how did the machine come about coming here to Titusville?
well, our old scanner was getting, it was 10, 11 years old, so that's, pretty common time to start looking, because you have to start worrying about getting the old one serviced and being able to get parts for it, and you want to have a service contract on it. You don't want something to happen and you can't provide an MRI service for a month because you can't find a part somewhere.
Right.
So we knew we had to start looking. Actually, it was last July, Dr. Cooperstein and I took a trip to New Jersey to a facility out there that has the Ingenia, and spent a half a day there with the staff, and got to see it, see how it works, see the images. So that gave us a good barometer of what was out there, what we wanted to get. So yeah, we were hopeful that we could get that, but we weren't positive that we'd be able to.
But you took the truck and backed it in just in case. You could load it up and bring it back.
I was
here.
wondering how you do a test drive of an MRI.
Well, we actually looked at several vendors. There are several large companies that make these, and not just Philips, but companies like GE, Siemens, Toshiba, and we had representatives from from those companies come in and give us presentations. So we looked at this pretty seriously. It made sense to us to go with Philips, particularly after seeing the machine in use. And hospital administration was extremely supportive. They said, if this is the machine you want, they'll find a way to pay for it. And so we have it.
Wow. So it's an early Christmas present for you.
Yes, and in the radiology department, we have a lot of Christmas presents. Our equipment is expensive, and we're talking millions of dollars.
Wow.
For pieces of equipment like this, and we have a lot of high tech, a lot of expensive stuff, and the hospital has never wanted to skimp on spending, and somehow they find the money to pay for these things.
That's great. And coming from Pittsburgh, have you enjoyed the smaller town life?
I do enjoy the community here. I have enjoyed the hospital. It's a very friendly place. I enjoy the work environment very much.
Not to put you on the spot, this may be a difficult question, but is it hard to kind of sort things out in your head at how well the Pirates are doing compared to the Steelers?
Well, it is bizarre world. It is bizarre world when the Steelers are bad, the Pirates are good, and we're looking up at the Cleveland Browns in the standings. So it's an unusual time.
Yeah, but a great time to be at the Titusville Area Hospital, and again, something that certainly not only you guys who are in the department are going to benefit from, but the community will benefit from having this technology here at the Titusville Area Hospital. Do you get any phone calls from other hospitals in the area saying, "How did you do that?"
Well, I haven't. I assume there's probably some envy out there, but I have not gotten a specific call. You, John?
No, not yet. We probably will.
We're looking forward to it. How can folks get a hold of you if they have any more questions on the machine, or maybe if they themselves are thinking, well, maybe I've had an MRI in the past, and maybe this would be a better way of seeing more detailed images from whatever my particular case is. I mean, what should they do? Should they call their doctor? Should they call up to the hospital? What should they do?
Well, to have an MRI, you have to have an order from a licensed physician in Pennsylvania. So usually the office will call and schedule the exam for the patient, but that doesn't mean the patient can't get an order from a doctor in Pittsburgh and call us themselves. They can do that. They can call directly to the MRI and talk to one of the MRI staff at 814-827-1851, extension 2610. They can talk to us and we'll schedule the exam for them. Usually, like I said, the office does that. Nowadays with insurance, a lot of MRIs need prior authorization before you just can't get it done. You have to get it okayed by the insurance company first. And the ordering physician's office takes care of that for the patient. They'll get in contact with the insurance company, tell them why they're ordering the test, and then the insurance company will give the okay or don't give the okay, but hopefully they authorize it. And then we'll schedule the exam.
Do you guys ever get a chance to just sleep or take a break? Because I just assume that you guys are constantly busy up there.
Never sleep. I can't tell you the last time I slept.
Just looking at the picture here, it looks a lot more comfortable. Have you guys actually tried laying in it just to see if it's different?
I've been in it. If anyone's had an MRI before and they come again for another one, they'll know as soon as they get to the doorway and look at it. It's that obvious that it's bigger. I mean, it's a lot bigger. There's a lot more room inside this
I think
one.
I remember the room that the old one was in, and it's kind of a smaller room, and pretty much took up the entire space. So
Yeah.
Well, the machine is big and it does take up space, but the bore is bigger. Excuse me. And patients do find it more comfortable.
excellent. Guys, thank you so much for your time. Greatly appreciate it. Love to have you back. Keep us updated on what's going on up at the hospital, and especially in your department and all this great technology up there. It's got to be great waking up every morning, going to work, knowing that not only do you have the support of the hospital, but the community, and to have this equipment here is amazing. So thank you guys very much for sharing it with us.
Thank you very much.
Thank you.
Alrighty, guys, thank you. Doc, John, Mark.
Great
Mark,
conversation.
Mark-
Come back again.
Sure. that was
Mark
bad.
needs a couple MRIs, I think.
I wondered about that.
Well, yeah, I've got them stamped on the side of my motorcycle helmet. So.